Ever heard of the medical condition called frozen shoulder? If you haven't heard of it, it is exactly as the name suggests. Your shoulder becomes frozen due to pain and stiffness. The condition is medically known as adhesive capsulitis that occur in roughly 2% of general population and usually in women between 40 to 60 years of age. Your shoulder is made up of 3 bones. Upper arm bone called humerus, your shoulder blade called scapula, and your collarbone. The head of your upper arm bone fits into round socket in your shoulder blade. A combination of muscles and tendon keep your arm bone centered in your shoulder socket. Frozen shoulder occur when these muscles and tendons thickens and tighten around the shoulder joint, restricting its movement. Frozen shoulder is more likely to occur in people who have diabetes or those who recently had to immobilize their shoulder for long period of time, such as after surgery or an arm fracture or suffering from arthritis. Symptoms of frozen shoulder are usually classified in 3 stages, as they worsen gradually and resolves within 2 to 3 years of period. First stage is freezing or painful stage. In this stage, pain increases gradually, making shoulder more harder and painful. Pain tends to become worst at night. At this stage lasts from 6 weeks to 9 months. Next is frozen stage. In this stage, pain does not get worsen and it may decrease. The shoulder remains stiff. This stage can last for 4 to 6 months and movements may be restricted. Thawing phase. In this phase, movement gets easier and may eventually return to normal. Pain may fade but occasionally reoccur. This takes between 6 months to 2 years. Over 90% of people find that with simple exercise and pain control medication can improve the symptoms. A frozen shoulder normally recovers, but it can take 3 years